Hey guys, welcome back to Yoga Therapy Thursdays. This week we're continuing our series on hip mobility. We did constructive rest in the last series, and if you missed it, please go back and check it out. It's basically just laying on your back with your legs up, allowing your psoas, or the biggest hip flexor, to release. This week, for hip mobility, we're working on actually moving. So you have three directions, sort of, maybe six if you want to look at it that way, that your hips can move. You have flexion and extension, which is your leg forward and backward. We had abduction, where you take your leg out, adduction, where you take your leg in, and then we have external and internal rotation. A lot of yoga is about external rotation. We don't have a lot of internal rotation, so we'll make sure we get all of those movements in today. First, we're going to start on our backs, moving through bridge pose. If you're familiar with yoga, this is pretty standard. You're going to lay on your back, palms go face down. Think about tucking your tailbone under just a little bit, drawing your navel into your spine, and lifting your hips up. Keep your gaze up towards the ceiling, and then lower your hips back down. Focus on articulating your spine one vertebrae at a time, really allowing your body to go through the full range of motion here. Now in yoga, we talk about inhale, lifting the hips up, because that's where we go into extension. And then we exhale as we lower our hips back down. But in exercise science or in group fitness, we work our exhales on the exertion. So as you exert the effort and lift your hips up, you would exhale. And inhale, lower your hips down. I encourage you to play around with both and allow yourself to see which one works best for you and your body. Which one feels most natural, which one feels most comfortable. And as you move through these bridge poses, notice where the weight is in your feet. Notice what muscles might be engaging as you lift up. And notice if there's any tension anywhere else. Like if you feel your shoulders tense up, or if you feel your core really start to engage as you lift your hips up. See if you can soften both of those areas. So feel free to continue moving through bridge. We're going to move on to windshield wipers, which is our internal-external rotation. It can be as simple as laying down here. You can take your feet a little bit wider apart. It might be a little easier. I do have a wall here, so hopefully my legs don't get stuck with that. But just allow your legs to fall to one side. Bring them back up. And then the other side. So this leg is currently an internal rotation. The other is an external. And then come back through the middle and again to the other side. You can play around with the breath in this practice as well. There is no right and there is no wrong. It's just discovering what works best for you. Just try not to go super, super fast. Move with your breath. So maybe this is exhale, inhale, exhale, inhale. Or maybe it's exhale, inhale all the way to the other side, and exhale all the way back. Your choice, your practice. Another option for windshield wipers is to do it seated. You can place your arms behind the back. Again, feet a little bit wider than hip distance. Usually mat distance works for most people. Again, move back and forth. Nothing really fancy, nothing really different. It's just a different place for your torso to be. So for hip abduction, we're going to lay down on our side. You can take your arm out and rest your head on it. You can bend it. You can get a pillow. Hand can come in front of you. Your bottom leg can be straight or it can be bent. It's up to you, whatever gives you the most stability. Straighten your top leg out. Think about making sure the top of your foot is parallel to the floor. And just lift the hip up, the hip, leg up and down. This is hip adduction. And for adduction, place that foot in front of you. Bottom leg goes out. And then that leg lifts up and down. And again, try to keep the either blade or the instep of your foot parallel to the floor as you lift. This doesn't need to be done a whole lot. It's just to kind of get that movement in and that hip mobility in. For hip and low back health, you want to start in constructive rest. You can do it as long as you would like, but I would suggest starting with at least 3 minutes. Allow your psoas to release, tap into your breath, allow that belly to expand and fall. And then move into hip mobility practices, like the bridge pose I just showed you, the internal-external windshield wiper rotations, and then also the ab and adduction with the legs laying on the side. Make sure you do both sides. I only showed you one side. All you have to do is flip over or roll over. So thanks for joining me this week. See you next week.